Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
You wondered if Duke was late to the game on vaccines. Is this something new and different that we need that will be helpful?
Well, the vaccine at Duke you're talking about? Okay, this is one of the 277 vaccines in development. They've only tested it in monkeys, so it's a little bit early to break open the champagne, but it's a step in the right direction. And they're focused on these variants and all the problems that we have with the other vaccines. Now, meanwhile, Moderna and Pfizer are gearing up right as we speak for the booster that they're going to release this September. Now, the funny thing is, they must know something that we don't know. Because they're saying, oh, at 12 months, you're probably going to need a new vaccine, just like with the flu. So they probably know it from their phase 1 and 2 studies that were done last year that, the original vaccine is not as good with the way the virus has changed. This is totally expected, by the way.
The other big news, of course, Pfizer saying they're going to offer vaccines to 12 to 15-year-olds. But you say the big problem is half of parents say, literally 50% say they don't want to vaccinate their kids that age.
Yeah, no, that's really surprising because kids are the ones that take most of the vaccines out there. They're the most vaccinated people anywhere. So, the thing is, even though the kids have mild disease, they do spread it. And then we don't know the long-term consequences of COVID yet. Anybody with COVID may have problems, 6 months, 1 year down the road. We don't know. Why you wouldn't want to protect your child from that potential when we know that it exists? And plus, some kids do get very sick. It doesn't make any sense to me. But I think also it's just so new. And I think we just have to get over the newness, look at the data very closely, have the committee review everything on Wednesday. That's just tomorrow. And get it out there. And I think you're going to see. The other thing is those vaccinated kids are going to have much more activities open to them at school once they go back in the fall.
What's going on with the report about outside maybe not as great as we thought, along with the story in the Seychelles, which is high 60% vaccination rate, getting new outbreaks? Is there some relation with these stories?
Yeah, I mean, the relation is, okay, there's this report from the University of St. Andrews in Scotland. They're saying, hey, there's less than 1% outside transmission. We can debate that. In the United States, we're saying it may be as high as 10%. These are models. We don't actually know the real number. We got to really just kind of figure it out. Very different place in Scotland compared to the United States. And the Seychelles, which is a tropical island, people are out all the time. They're the most vaccinated country on Earth, or island anyway. Something just doesn't make sense here to me. So, I'm a little skeptical. Is probably not 1%, but maybe it's not as high as 10%. But there's plenty of transmission outdoors. It's probably related to density. How people are packed in together and what exactly are they doing? Are they screaming, like yelling at a sports event or something like that? It's probably related to that.
All right, let's get to some viewer questions. How much is known about long-term effects, risks for those under 12 to get the vaccine?
Yeah, so, we don't have the data yet. So they just released the 12 to 15, and it looks, I actually was kind of surprised. The FDA said, we got 100% efficacy and it's safe in over 2,000 kids that were tested. So they actually had the announcement before the committee even meets tomorrow. They're very confident, okay? They're not going to release it until the committee votes, but that was a very interesting thing. I think what they're doing is, it looks so good. They want the cities, states, and territories to prepare to start vaccinating these younger people. Under 12, we don't really know, but those studies are ongoing, and they're going to be done in the next couple months, and they're expecting EUA application by September.
Very quickly, one last question. What are Sweden's infections and death rates? Are they the worst in the world, seeing as how they didn't take the necessary precautions?
I'm really glad you brought this up because we haven't talked about Sweden for a long time. There's been a lot of reports in very respected journals like The Lancet that have looked at really what happened in Sweden. It was a complete and utter failure. Hands down failure. They had one of the highest case rates. They had one of the highest death rates. Because they had basically no controls, they were infected with the variant first, which made things even worse. It's a total failure. And if you compare it to the other Nordic countries around them, which did what everybody else in Europe did and used mitigation efforts and locked down, closed schools and whatever, 5 to 10 times worse. I mean, they are the outlier. It's a disgrace, and the people that were running that public health program should be removed from office. I mean, that was an experiment that failed.
All right, if you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Thanks, Doctor.
Thank you. Have a great day.
You too.
Hey, Paul.